Welcome to Houston Newsmakers Extra. I'm talking with Dr. Sandra McKay. She is a pediatrician, but also a non-resident fellow at Baker Institute at the Health Biosciences part of the Baker Institute for Public Policy. 246 mass shootings I was looking at up at the time we're doing this. And that's on pace with last year, which was the worst on record. Talk about some of the studying that you're doing that kind of can help lead to us having less opportunities for that. I mean, in terms of, you talk about safe storage for kids so that they can't get to guns. What else is out there that you're studying that can talk about some of those issues that are happening?
Yeah. So some of the work in particular that I'm doing is we've actually looked at our patient population and talked with them about how we can improve safe storage within the homes. And when we've talked with our patients, some of the surveys that we've done is looking at who is the right messenger for our families. And with those, we've learned that it is not just pediatricians, but also law enforcement and firearm retailers. Our patients want to have those conversations about safe storage and how to have those better conversations with those retailers. So we've partnered with our firearm retailers to talk about how we can have those conversations on safe storage and also, even extending on to suicide prevention with those firearm retailers. We're partnering with the industry.
Now, that sounds like something that's a little different than what we've been hearing. We don't hear that conversation at all when we talk about the conversation about, quote, gun control and those kinds of things. Is that something you hope is going to catch on across? Because is this national that you're doing this, or is this local for now and expanded?
This is local for now, but I hope that it expands more nationally, because we've done a project here within the state of Texas where we've actually looked at contacting regional retailers across the state of Texas, asking them who provides temporary emergency storage in times of crisis for families. Mm-hmm. And there's not a lot of retailers that offer this service, but there are several across the Texas state that will offer temporary emergency storage. And in those conversations with folks, we've had several instances where retailers were reaching out to us saying, we do a lot of education with people during that point of sale. Mm-hmm. We would like assistance and help with developing better resources, better education for our customers, mm-hmm. because we are the experts in firearms, and they sell them, right. But there are opportunities for us to engage and to partner better between healthcare and industry, because firearms are here. We have a Second Amendment right. They're not going away. Mm-hmm. And we need to collaborate with them because they are just as much a key stakeholder in this battle against gun violence, and we should collaborate with them.
And it sounds like it's just a matter of making it a higher priority, point of sale, getting that information out there, making that one of the primary conversations that they have at point of sale. Hey, storage. If you're going to have a gun, that's important.
Right. Absolutely. And one of the things that they do is they spend a lot of time tailoring their conversations with making sure they're buying the appropriate firearm to them. And then they talk with them a lot about safety handling, but again, are they having that appropriate conversation about now, how are you going to plan to store your firearm at home? Do you have kids at home? What are your home situation mm-hmm. like? It's a natural extension to their conversations that they're already having. So we're working together collaboratively to see how can we elevate those conversations. And then also they're teaching us a lot about, what kind of language and words should we be using in our healthcare encounters mm-hmm. as well, so that we're not, doing something that's culturally insensitive to the firearm owner as well.
So when you do this, what is your hope about the policies that you and your organization at Baker, at Health Biosciences, the research you're doing? What is your hope regarding what you're putting into practice now, policy-wise, locally, that you're suggesting, that it can be embraced nationally, that some of the policy makers nationally, because if they're not listening, it doesn't matter. I mean, it's like the January 6th commission hearings that Fox said we're not going to air it. That means if people normally watch that network, they're not hearing it. Same sort of scenario. If the policymakers aren't hearing your information, what's your hope?
My hope is that we get excellent evidence to show that we can collaborate. We can build a program that's effective and will show evidence that it works, and we can reduce firearm injury and death in children. And what I've said repeatedly in multiple venues is that the greatest threat to gun rights is gun violence. And if we can reduce gun violence, then we can secure the rights of our, firearm owning citizens and reduce death and injury to children. And that is our ultimate goal, is to keep children safe.
Fabulous. Dr. Sandra McKay. Hey, they're having their symposium at the Baker Institute on June 21st on Houston area policy. And people can sign up. It's free, right?
Yes, it is. We do require registration.
Okay.
So it's available online. Go ahead and register if you'd like to hear more about the local programs and policies that we're looking at.
Good deal. Thank you very much. This is Houston Newsmakers Extra. Share it with everybody you know.